Hello and welcome. In this session, we'll explore Learning Outcome 1, applying tools and techniques for cost accounting in health and social care, and see how they help organizations manage finances effectively. Costs in healthcare can be complex, but understanding them is vital. They include direct and indirect costs, each impacting financial decisions differently. Direct costs are linked to specific services or products. Indirect costs, however, are broader, covering overheads. Identifying these helps in accurate cost allocation and management. Determining a cost unit is essential for precise accounting. In healthcare, a cost unit might be per patient, per bed, or per operation. This varies across different healthcare providers. Understanding what constitutes a unit helps in calculating costs effectively. It ensures that pricing and budgeting are accurate. Various costing methods are utilized in healthcare. Job costing, batch costing, and process costing are common. Each method suits different operational needs. For instance, job costing is ideal for unique patient treatments. Batch costing fits well with bulk service provisions. Absorption costing includes all costs in product pricing. Marginal costing, however, considers only variable costs. Both methods have distinct advantages. Absorption provides a comprehensive cost view, while marginal aids in decision-making. Selecting between them depends on organizational goals. Activity-based costing, or ABC, is pivotal in healthcare. It allocates costs based on actual activities. This method enhances accuracy in cost management. By focusing on specific activities, ABC identifies cost drivers. It provides a clearer picture of resource utilization. Cost centers are crucial for financial management. They represent parts of a business where costs are tracked. In healthcare, these could be departments like research or HR. Cost centers aid in accountability and budgeting. They ensure costs are linked to specific outputs. Beyond cost centers, healthcare organizations may use profit and investment centers. Profit centers focus on both costs and revenues. Investment centers add the dimension of investment decisions. These centers help in strategic financial planning. They align departmental goals with organizational objectives. Designing an effective costing system is vital. It involves selecting appropriate methods for accurate cost tracking. A well-designed system supports decision-making and control. It should be adaptable to changes in healthcare operations. Continuous evaluation ensures its relevance and effectiveness. Costing methods directly affect profitability. Accurate costing ensures fair pricing and resource allocation. It helps in identifying profitable services. Mismanagement in costing can lead to financial losses. Thus, a robust costing strategy is essential for financial health. Healthcare uses various costing approaches. First in, first out, and last in, first out are common. Each has its own impact on inventory valuation. These approaches help in managing material costs. They are crucial for accurate financial reporting. Evaluating unit costs is critical for pricing strategies. It involves analyzing costs per service or product unit. This evaluation aids in competitive pricing. It ensures financial sustainability in healthcare. Continuous assessment helps in adapting to market changes. Healthcare organizations must constantly improve their costing systems. Recommendations include adopting new technologies. Streamlining processes can enhance efficiency. Regular training ensures staff are up to date. These improvements lead to better financial management. Effective planning and control are key in healthcare finance. Costing systems play a crucial role here. They provide data for strategic planning. Control mechanisms ensure adherence to budgets. Together, they support organizational stability. Assess your understanding of costing systems. Rate your knowledge on a scale from 1 to 10. Identifying gaps helps in targeted learning. Continuous improvement is essential in healthcare finance. Stay updated with the latest practices and tools. Understanding and improving costing systems is key to success in this sector. If you need any further information, feel free to contact us on WhatsApp at 0748436168. We look forward to welcoming you at the next session. Thank you.